Good afternoon. My name is Shefali Shah. I've been very involved with this clinic from the beginning, and it's an incredible opportunity that I'm so proud of. I learned a lot from just being a part of this clinic, and the most important thing I learned was preventative health care and how important it is to you, to your body, and what you do to it. So with that being said, I would like to invite our first doctor, Dr. Jignesh Shah, to the stage.
I'm just going to ask all the co-directors to come up as well, Dr. Parin Shah and Dr. Mona Shah. I wanted to thank, my name is Jignesh Shah. I'm a practicing gastroenterologist in Greater Houston. I'm one of the medical directors with Dr. Shah and Dr. Shah. A funny joke about the Shahs is when we applied for a license to the Texas Medical Board, one of the replies we got back was, "Are you guys all related?" We go, "We have the same vision, but we're not related." Vivek as well, and Shefali as well, and all the Shahs. So I would like to thank the mayor's office, the sheriff, council general who stepped out for a little bit for their continued support for these clinics. Without Vivek, Shefali, Deepika, and Swap's support, these clinics wouldn't be here. Our main goal, what we sat for the last 2 years, what can we do for this community? As practicing physicians, we know the cost of healthcare is going skyrocketed. There's so much need that's involved. There's acute medical problems and chronic medical problems. So how do we tackle these problems? We go back to the basics. We go back to nutrition, exercise, dietary modifications. And that's the essence of these clinics. Go back to preventing these acute illnesses by basic nutrition, exercise, and diet. So that's our goal as phase 1, probably phase 2 and phase 3 as the years progress, as Swap said, and sometimes we got to slow Swap down. He wants 50 clinics. We go, let's just start with the first clinic with basic care. Moving forward, we'll probably do more preventive care as in vaccinations, blood pressure monitoring, dietary monitoring, diabetes checkups, etc. But once again, thank you for everyone's support to the clinics, and congratulations to the Karya Kares team. You guys done an exceptional job. Deepika, Swap, Vivek, Shefali behind the grounds. By the end of this, I think you guys are all going to be tired of physicians. And I'll give the floor to Dr. Parin Shah.
Thank you. Another big round of applause, though, to Swapnil, Deepika, and the family. And you know what I'm thinking actually is that Aryan's here, right? And he's seeing all the success that you guys have done throughout the years. And now he gets to see how you guys give back to the community. And I think that's fantastic membership, just fantastic overall, and great mentorship. High blood pressure is the leading risk for death worldwide. 50% of people with stroke have high blood pressure. 50% of people with cardiovascular disease have high blood pressure. Diabetes is one of the top 5 leading causes of death in the United States. And we spend over $400 billion a year trying to manage diabetes. I'm an emergency room doctor. I practice in Chicago, in the Bronx, in Houston, and in San Antonio. And I've seen many uninsured patients come through our door. And not only is it hard for the patients, it's hard for the families that take care of them. And it's hard for us as taxpayers to absorb that cost and the drain it takes across the board. So I'm so glad that Swapnil Agarwal, Deepika, family, and everybody else here has put this together for the community at large. I want to thank Swapnil one more time for his vision. I want to thank Deepika for her persistence in making this happen. Vivek Shah for the drive and the passion for nutrition, obesity, diabetes, and high blood pressure clinic in this area. And Shefali has been fantastic in the background. So thank you all for putting this together. Swapnil wants to do this across the country in every city. And if he likes us enough, hopefully we can collaborate with him in every single city as well. So thank you all for this. Thank you for your time, and looking forward to this project. I'd like to introduce my wife, Dr. Mona Shah. She's a pediatrician, pediatric emergency medicine physician, did ultrasound and many other fellowships as well, but I think she's instrumental in helping this clinic get the youth touch on obesity, high blood pressure, diabetes, nutrition early on. Thank you.
Thank you, Parin. I paid him well, didn't I? Anyway, thank you so much for having us here. Obviously, Deepika, you've done a beautiful job tonight. Swapnil, Vivek, Shefali. I mean, this is an amazing event, and more than that, it's an amazing vision. These wonderful doctors have already told you we have this need in the community. We have it all over the country. And I represent the little ones, right? So children are so important to our society. They are the future of our society. And not only as a physician, but more than that, as a mom, as a parent. Taking care of our kids, making sure they eat right, making sure they grow up and they don't develop diabetes and high blood pressure and other issues. Especially now with the COVID pandemic, we're seeing a lot of these issues that are in adults are coming into the children. So thank you everyone for coming here. Thank you for supporting us. This is a wonderful, wonderful thing, and we hope to continue it. Have a wonderful afternoon. Thank you.